Back at the bargaining table, Catholic Health and CWA are still trying to find common ground on a contract as the union strike at South Buffalo Mercy continues. Channel 2's Rob Hackford is live at the hospital as the picket heads into day 7. What's the latest, Rob?
Yeah, Mary Ellis, the proposal from Catholic Health remains the same as the one presented last week, but with both parties back at the negotiating table, it'll be up to the CWA to offer their critiques. Now, we know the major demand from the union remains to be staffing ratios, where they want to balance out the number of patients that nurses and technicians are caring for so they're not overloaded. Catholic Health CEO Mark Sullivan rehashed the hospital's 3-part staffing proposal during a press conference today. It doesn't include ratios explicitly, but does propose adding 258 full-time associates, using staffing grids to control the patient-employee balance, and bonus pay to compensate nurses or technicians who help out when those targets aren't met. But without ratios like ensuring 1 nurse for every 2 patients at any given time, the union worries things won't change.
There's probably examples of that in every hospital in this nation. The goal is that's not what we're about. We're about making sure we can change that, which means when we read the staffing proposal, that helps us start to address that.
I know it'll be changed. I know that, both sides are working very hard, and I know that both sides really do want to come to an agreement, and everybody wants to get back to work and take care of the patients.
Well, Sullivan said despite the lingering disconnect, he's encouraged just being back at the table, and the hospital is, quote, operating as best they can amid the strike, but is economically strained. Well, Sullivan said patients remain their #1 priority here at South Buffalo Mercy. There are 32 people receiving care at the hospital and about a dozen people being admitted every day. Well, the other Buffalo hospitals are still picking up the slack where they can. At South Buffalo Mercy Hospital, Rob Hackford, Channel 2 News.